And part of that wow factor is Hilary's contribution, because she understands, I think, and I'm asking her to share with you, just the whole food in relationship to the body and the mind and soul, but also how we interact with food, what food means to us, and what the bigger food industrial complex means, impacts who we are and how we consume food.
Thank you, Eleanor. It's been lovely working with you over the last year, and I'm really excited to be here to talk with all of you, because I started out this process at age 24 with no knowledge about health, with a father who had just had a debilitating stroke and was unable to work, and a mother who had breast cancer, and then all of a sudden finding myself diagnosed with fibroids and not knowing what that meant or what it was, and fearing that now I had cancer. And so through the process of supporting my parents and learning about myself, I educated myself about health, and it's wonderful to have the opportunity to talk to you. And so during that time, some of the very first information that I learned had to do with food. And so we live at the nexus of all sorts of very powerful but often invisible to us forces. So you all live in Washington, D.C., and so you have visibility to the political process. So for instance, in the United States, there are 2 political parties. There are many political parties in other countries. And so in terms of our food supply, there are a lot of invisible forces, and they affect the choices that we believe that we have. And sometimes to be healthy, we have to extricate ourselves from the mainstream and dominant system so that we can be healthy. So for instance, in the United States, several foods are subsidized by the government. So I'll just name a few for you. So wheat is the production of wheat, corn, soy, dairy, sugar, these kinds of foods are subsidized by the government. Say again? All the things that make you sick. Right, no, so Dr. Sullivan just said all the things that make you sick, which is really where I'm headed. And so these foods are subsidized by the government, and so it's very easy, particularly if you live in a black neighborhood or an integrated neighborhood, to walk to the corner to find a 99-cent meal deal, which will be composed primarily of bread, some rice thrown in there, a lot of sugar, that kind of thing. But an apple, a single apple, may cost you 50 cents or $1 or a banana. And so food that ultimately contributes to people's illness, in large part because it gets processed and nutrients get stripped out of it, and other things, so it can be shipped around the country, so it can sit on your shelf for 6 months, so you can have the convenience, because we're all overworked and stressed and single moms and that kind of thing, or maybe so it'll be more affordable. But these types of foods, particularly when they're processed, don't provide our bodies with the nutrients that we need. Therefore, we don't have the energy that we need. We have cloudy thinking. We don't think. We don't sleep as well as we need to, and our bodies can't rejuvenate and regenerate ourselves, and we don't fulfill our potential in the world. To eat more healthily often requires that you step outside of the food system or shop around the periphery of the supermarket. All the middle shelves, you go for rows and rows and rows, and it's all sorts of foods that over time contribute to illness. You're not going to die if you eat something once or every now and then, but if these are the foods that you rely upon in the center of the supermarket, over time it's pretty predictable that you'll end up with what they call diseases of civilization, processed foods. If you go to indigenous places where people eat a more natural diet, you see less of these diseases, and in some places, some of the diseases that are very common for us are quite unheard of. And so we might consider sometimes shopping at farmers markets or shopping at co-ops, or coming together to shop together so that we can buy food that is organic or more healthful, so we can buy it collectively and in bulk so that we can afford it. Or we can, I interviewed a woman in Philadelphia who came together with some neighbors, and they created a co-op, and they have a co-op in a low-income neighborhood of Philadelphia, and they order food, they bring it in, they'll text you to tell you that the food is here, they'll tell you what they have, and they'll either deliver it or you can come get it. So there are all sorts of alternate ways that we can extricate ourselves from these structures so that we can be proactively healthful and less reactive to disease.